This is a comprehensive checkup with your primary care physician, covering your general health status. It typically includes checks on vital signs, heart, lungs, and a discussion about your lifestyle, diet, and exercise. High blood pressure is a silent risk factor for heart disease and stroke. Adults should have their blood pressure checked at least once every 2 years, or more frequently if recommended. High cholesterol levels can increase your risk of heart disease. Adults should have their cholesterol checked every 4-6 years or more often if they have risk factors for heart disease. This involves checking your blood sugar levels. Adults should consider getting screened for diabetes, especially if they have a high body mass index, BMI, or a family history of diabetes. These vary based on age, gender, and risk factors. They can include mammograms for breast cancer, pap smears for cervical cancer, colonoscopies for colorectal cancer, and skin examinations for skin cancer. This test, typically recommended for women over 65 and men over 70, checks for osteoporosis. Regular eye exams are important, especially as you age or if you have risk factors for eye diseases. Regular dental exams, including cleanings and oral exams, are crucial for maintaining oral health. Especially important for older adults, regular hearing tests can help detect early loss of hearing. Stay up to date with vaccinations, including the flu shot, tetanus boosters, and others as recommended for your age group and health status. Mental health is as important as physical health. Regular check-ins with a mental health professional can be beneficial, especially if you have symptoms of depression, anxiety, or other mental health concerns. Remember, the frequency and type of health screenings can vary based on your age, gender, family history, and overall health status. It's always best to consult with your healthcare provider to determine the appropriate checkups for your individual needs.